Do you have aging hands and want them to look like baby smooth hands again? Maybe you've played the piano for a long time, played the guitar, and you've just worked those tendons and muscles and they look a little older than how you feel. Well, we can help with that by adding filler there. So I'm going to show you how easy the procedure is. I've already done a little bit of lidocaine and we're going to use a cannula. So I always start with a little lidocaine. In the spot we're going to put the cannula, and I'm going to make a little pilot channel. 1, 2, 3 with the needle. So I've done that now, and I'm going to take my filler and I am going to go, if I can find that little spot I just made. Let's see. Her hand, her skin heals up so quick. Well then, there it is. Finding the little, there we go. There we go. And you can see where the cannula is. And we're gonna just start to inject just slowly. And we can go all the way up and just give a little filler there. There we go. I'm sorry, you okay?
Mm-hmm.
Okay, we're gonna just go all the way around. I like doing it with the cannula approach because it lays a lot easier, lays a lot flatter, and it's very pretty. And you can see right away the improvements in her skin. And you won't be able to see those vessels like you were before. And I did take some before pictures, and we're gonna take some after pictures when we're done. But Radius is the only filler that has the indication for hands, the FDA clearance to treat hands. So that is a great thing. And here we go all the way up, all the way. And it doesn't take that long. It will last a year. Obviously, the dose equals duration. Some people need 1 full syringe per side, which is typical. It's typical 1 full syringe per side. And then I have people come back in about a week or 2 weeks. We take a look at them. And if we need to add more, then we do so at that time. But can you see just how quickly her skin has changed? This is not going to limit her from doing anything. But see how pretty that is? We're going to go to the other side. Did that hurt?
Mm-mm.
Okay. Did she sound convincing enough? I don't know, but okay. So let's go to the other side. You've already done that. So I'm gonna just tent up the skin. Can you feel that there?
Mm-hmm.
You can. Okay, how about down here?
Mm-hmm.
You feel that as a poke? Or just as a pressure?
Pressure.
Pressure, okay. So let's tent it up. And do 1, 2, 3, that's it. Like that. That's all. Now we're going to take our radius. We're going to go through that spot. Let's see if we can find our spot again. Again, your skin heals so fast. It's here. Is that it? Yeah, okay. Okay, you okay?
Mm-hmm.
All right, here we go. So we're just going to put that in. The nice thing about this filler is that it will make you make collagen, which is great, especially in areas where we need it. Like, well, I guess we need collagen everywhere, right? And it'll last you for a year. And again, 1 syringe per side really does the trick. Sometimes you need to do a little bit more. So I think I got one patient, she uses 2 syringes per side, but she comes in, she's played piano forever and has really worked her hands for a long time. And I know you can see it kind of bubbling up there, but all that's going to smooth out. I always have my patients sit on their hands for the next, well, whenever you're sitting, just sit on your hands. It'll help smooth out the filler. And the warmth helps it too. It'll feel better that way too. So we can go all around. Good. Almost done. She's probably happy. But it doesn't take that long. And you can cover the entire hand from just that one spot. So really there's no downtime from this. Because we're using the cannula, it has really low risk of bruising because I'm gonna push aside these vessels that are in her hands. I can't get into the vessel with the cannula. If I had a needle, I can get into the vessel and then we end up with more bruising, but I can't get into the vessels with the cannula because it's a blunt tip. So you can see what a nice result we have already. And again, so I'm gonna have her sit on her hands for a few minutes here. And we'll take some pictures and we'll show some before and afters. Maybe she'll need a little bit more, maybe she won't. But this looks great right now. Again, there's no limitations in what she can and can't do afterwards. And I don't think nobody's gonna even know that she did it because this is the only spot where we went in and she doesn't have any bruising. So if you have aging hands or you just don't like to see the veins, come and talk to us at Rejuvenation MD about doing some hand filler. I am sure you will love it. And if you enjoyed this video, please share it, like, follow us, subscribe to our YouTube channel, and most importantly, come in and see us.